So delighted to be here with Rob Thomas, who's recently joined the Novartis UK team as our head of public affairs. And what a better time to have a conversation after an election, a new government, but also a sense of urgency around needing to see change for life science in the UK and for patients. Welcome, Rob, and I would love to get your view with that sense of urgency of how do you see the view of the new government, the new Labour government, around life science?
Thanks, Emma. Firstly, it's great to be here at Novartis. I couldn't have arrived at a better time with the general election now complete and a new Labour government in place. Everybody will know that Labour are really focusing on growing the economy, and it's great that they've identified life sciences as one of those growth sectors, and rightly so. I think the UK has a very strong life science sector. It's a jewel in the crown in many senses, with its world-leading academic institutions, a single-payer system in the NHS, and incredible data and digital infrastructure as well. So it's somewhere that I think the pharmaceutical industry has been operating for some time, and I'm sure Novartis and companies like us are keen to work with Labour government to really help accelerate growth in the UK.
When I hear indeed the life science and the agenda for growth is really important, and at the same time I'm reminded of the King's Fund report of just last year that really showed where we were ranking in the OECD countries in terms of patient outcomes in some therapeutic area, and there's clearly an urgent need to drive change. So that patients across the UK have the care that they need. What's your view on what does a new government need to do differently so that at the next report, from a patient outcome perspective, we're ranking on top of the list?
Yeah, I think it's a complex ecosystem, and therefore it warrants a whole system approach where all of the players within that ecosystem come together, contribute their ideas, and then sign up to delivery. And I think that's possibly one area that a new Labour government can really sort of sharpen the pencil around accountability and around implementation.
I think that you said the key words of accountability, and it's not necessarily new big ideas, but what we're hoping for and what we want to work with the new government is really that implementation and delivery, so that both the life science vision and the patient at the same time can benefit from this new government.
Clearly at Novartis we're a very good organisation at pulling people together, pulling different stakeholders together. So we have a very good ability to convene. We do that through our research and the clinical trials that we do here in the UK, but we also do that through the partnerships that we undertake here in the UK as well. So that's a big part for Novartis, working alongside academia, alongside the NHS, looking at bottlenecks in the system, and trying to find ways of innovating, improving patient care, and ultimately improving patient outcomes.
Very good. I think we look forward to the next weeks, months, and years ahead, and to continue that collaboration and indeed all work together to improve life science and the patient outcomes in the UK. Thanks, Rob.